Hi, and welcome to Meet the Mayor. We have with us today Maplewood Mayor Frank McGehee, and also, luckily for us, Candice Davenport, who is the Health Officer for Maplewood Township. And Candice has been the Maplewood Health Officer since about the first of the year. But prior to that, she's had 20 years experience as a public health nurse, a health educator. She was a registered nurse where she worked in pediatric ICU and maternal child health. And she's held various government positions at the federal, state, county, and local level. And that has been notably in the areas of bioterrorism preparedness, response, immunizations, and environmental health. At Rutgers, she developed a report on best practices for pandemic influenza mass vaccination clinic response and conducted work on public health. So we're really happy to have her with us. So Candice, perhaps before we get started, if you could just, maybe there's some of us who aren't familiar with the public health office and what the health officer does. So maybe just a quick idea of roles and function, if you would.
Sure, thanks, Larry. So one of the things that the health department does and the health officer does is we represent public health at the municipal level. We're charged with protecting the health and safety of all the Maplewood residents, and we look at the community as one big patient.
Okay, so, obviously we're here because of the coronavirus situation, and what are some of the statistics for coronavirus in Maplewood?
So as of yesterday, we have 197 cases with 10 deaths, unfortunately. We've had 57 recoveries and 203 negative cases.
What is a negative case?
That they tested and the test came out negative for COVID.
So they did not have COVID, but this doesn't immunize them or anything, does it? It just means they haven't had it as of yet.
Yeah, we'd like to say that people who have recovered have developed some immunity to the virus, but we don't know how long that immunity will last for.
Okay. So where do we get this information? How is this accumulated?
The state health department has a statewide system called CDRS, and it stands for Communicable Disease Reporting System. And they send out lab reports on all communicable or infectious disease cases.
And do we report back to that same organization? So
Yes.
They give us information and we give them information back. What kind of information do we give them?
Once we find out about a positive case, we at the health department call up each patient and we do contact tracing and educate them about isolation and quarantine and how to protect themselves.
In contact, we're hearing a lot about contact tracing. So I guess is that going to be pretty critical for the recovery or the decision as to when we think we have this under control?
Contact tracing really helps us to control the spread of disease. So identifying who they've been in contact with before they were symptomatic and when they're symptomatic helps us to control the spread of disease, to tell them to stay quarantined or isolated.
Okay. Now, one of the things, I wonder if you can give us some guidelines for people or families to use. For example, there seems to be no differentiation in guidelines between healthy people and people who have underlying health conditions. I found that kind of confusing. I don't know if other people have, but I remember at one time I saw some kind of guidelines that tried to differentiate between people over 60 who were healthy and people over 60 who weren't healthy. But frankly, I find it kind of difficult to understand exactly where individuals fall into these categories. Can you give us some ideas or why it's so broad, or does it have to be so broad?
Sure. So it's probably easiest to say that everyone should stay home if they're sick and stand 6 feet away from each other, especially to wash their hands after being in any public space, and to avoid visiting those who are elderly or have underlying health conditions unless they need help with medical needs. That being said, for those with underlying health conditions or those who are elderly, we advise them to stay away from public spaces as much as possible so that they reduce their risk of getting infected. We would also say that for those who are elderly or with underlying health conditions, that they should talk to their doctor to figure out plans for when they need medication, how would they get medication, how would they contact their doctor, what is their alternative plan for caregiver if their caregiver becomes sick, and what hospital their doctor is affiliated with if they have to be taken to a hospital and if they're sick.
And as far as a family unit goes, you know, husbands and partners and wives and kids, um, do you look at them as a kind of like a single unit, like you would a person? I mean, do they have to do things differently internally inside the house, or can they go about their normal activities as long as they're all together and they just have to worry about perhaps extra precautions when they leave the house?
Yeah, we look at every family as one team, as one unit. So every action or behavior that the mom or the dad or grandparents or the children do really affects everything else that happens in the house. So every contact we have with anyone outside of our household could be a potential case for transmitting the disease in different ways. So if all of us stay together in our house and have 6 feet of distance from those who are not our household contacts, that's helpful. And then if you have to go out for essential needs like washing your hands after coming in from a grocery store or from the pharmacy, that's really helpful also, because then we don't bring it home to our loved ones.
Okay, so you look at it as a unit in that sense, but internally inside the household, if they haven't been in contact with anybody or they've taken the precautions of washing and so forth, they don't need to maintain a social distance, do they?
That's correct, right. If you are not sick and you have not been in contact with a coronavirus patient or suspect patient, you can go about your business and do all the things you would do with your family. You can hug them, you can eat dinner with them. We would just always advise to wash, disinfect shared surfaces. It's just a good general precaution. That's something that you can do at home. But as long as you are healthy and you have not been in contact with anyone or put yourself at risk for being in contact with anyone who's positive or suspect, then you do not have to. If you are positive or you are sick, those precautions change.
Okay, and you mentioned hand washing and so forth, which is I've gotten real good with the alphabet these days. But why is hand washing so important, and why for the 20 seconds?
Okay, so we touch our face either 3 times an hour to almost 20 times an hour. So we don't know that we're touching our eyes, nose, mouth, and all these other ways that respiratory droplets like coronavirus can get into our body. So it's really important. One of the best protective measures aside from social distancing is to wash your hands, because we don't always know when we're touching our face, and that's how we can expose ourselves to respiratory droplets. Why the 20 seconds? It's just a good precaution, because then you can use the friction motion with soap and water to remove the dirt and germs away from your hands.
Okay. Got any other songs?
Happy birthday works, ABCs work, or just counting for 20 seconds.
Okay. What was so extraordinary about this virus, if I may ask? Because it seemed as if very, very early people began to get concerned, and it struck me personally. It struck me as different than when they've talked about flu and other things in the past. Was there something about this virus that's particularly different?
Yeah, I think what I would like to emphasize is that we are in an unprecedented public health crisis. We are in a global pandemic, and it's something that we have never seen in our lifetime. And this is probably one in a century kind of incident. So we've never experienced anything like this. What I will say about the coronavirus is what makes it different from, let's say, the flu is the speed, the scale, and the susceptibility that we are to this novel coronavirus. So while coronaviruses come from the common cold, this one is a novel one that we have not seen before, and one that can cause severe illness, which includes hospitalization and unfortunately death. The other thing that's significant about this is because with the flu, we at least have a vaccine, so that helps us to protect ourselves, even for how good it is each year, and the percentages change, but at least it's protective of flu. But we don't have a vaccine or treatment for this. And the other part, and the most significant part when we were going into it, is watching China and their studies, and Italy, and seeing that it's almost 1% to 2% of all cases result in death. So if you look at Maplewood, we have almost 25,000 people. If we didn't do the social distancing precautions, we would be looking at 250 to 500 residents who would have died because of coronavirus. So we have to stay the course and do what's necessary to prevent all of those diseases and deaths.
And a vaccine is going to be dependent, I guess, on a more basic understanding of the virus itself, or is it just a function of testing it? I mean, any thoughts on that?
They're looking at, there are multiple ways that they're looking at vaccines right now. They're in some clinical trials, but we have to see how it works. And because we're looking at a virus, viruses change, just like with the flu. We create a new vaccine every year. So we are, the scientists and researchers and immunologists are working really hard to look for a vaccine, and two, a test that will look at antibodies to see if you have been infected, if you've recovered, and to also do a rapid test. Rutgers is looking at, they've implemented 15 rapid testing machines in New Jersey. So those are in beta. And if those work, they're looking at testing people within 15 minutes and getting a result. And that's a major game changer for us.
From your perspective, with the background that you have, I mean, what percentage of the people would you think need to be tested, and with whatever the results are, before a government can decide that it's time to start to ease up?
Right. So probably not the percentage of people, but it's more of like the pillars that allow us to open up. And one of those would be mass production of diagnostic testing and availability of diagnostic testing. If you can identify someone who's sick and isolate them and then quarantine their family and close contacts, you could prevent the disease. But if we don't have mass production and testing, that we're going in blind. So that's one piece that's missing. The other part is vaccine. If we had a vaccine, then we could vaccinate everyone as best we could, like with all of our other vaccinations, like measles, mumps, pertussis, and flu, for example, and we could create a herd immunity or protection for everyone. So we are eagerly waiting on those. Until then, we have to do the social distancing practices, which are very effective. Okay. And that's something that the whole community can do.
One thing, what about masks? We okay, yeah. Well, my mask's a little different, but I think I heard that the masks are most effective in preventing us from infecting other people.
That's correct. Yes.
So
yeah, one of the things that we want to say is that when you wear a mask, if everyone wears a mask, then we are helping each other. We are protecting one another. What we're finding with the coronavirus is that you can actually be asymptomatic, which means you have no symptoms, but could be a carrier of coronavirus and then be spreading it through your respiratory droplets from your mouth or when you sneeze or when you cough, just by simply talking. So if you wear a mask, you're preventing those respiratory droplets from falling on shared surfaces, like when you go to the grocery store or the pharmacy, and then you protect others from that. So if we all wear a mask, we protect each other.
Yeah, I'd like to just add to that point. You know, Candice is 100% right. You know, we as residents in our community, we all should really think thoughtfully and have a mask with us when we're walking as families, walking our dogs, just interacting. It doesn't necessarily have to be just grocery stores and pharmacies. It should be just when we're out in the public. And when think of it like you're doing something for the community, you're protecting others. If you're asymptomatic, you theoretically could be spreading, you know, the virus to others, you know, and unintentionally. You know, but just to wear some type of mask or facial cloth, you know, when you're getting close to interacting with others, I think that's most prudent. I've walked my dog, you know, recently and seen residents not doing that, you know, and it's a little disturbing to me personally, you know, because, you know, we're in this together. And if we are thoughtful about that, then we can, you know, get ahead of this and continue to do the right thing. So it's like, if you're going to go for a walk with your family, which we encourage, getting exercise and getting some fresh air, you know, everyone should have a mask or something, face covering, and then you get close to people, let's cover up and you know, be thoughtful for others.
Well, Frank, if we can take a break for a minute, we'll do that, and then we'll come back. Okay, so we'll be back in a minute. Okay.
Hello, this is Mayor Frank McGehee. Do your part to stop the spread of coronavirus. Stay home and minimize outdoor interactions when you can. If you're sick, you should particularly stay at home and call your doctor. If you have children, keep them home if they are sick. Work with your employer or help your employees with telecommuting options or staggered work hours. If you do plan to go out, practice these important habits. Wash your hands well and often. Cover your nose and mouth when you sneeze or cough. Put more personal space between yourself and others. Try for the recommended 6 feet of social distancing if you can. And please do your best with social distancing at grocery stores, the local CVS, Walgreens, and pharmacies. Call, text, or video chat family and friends to stay connected. Don't visit seniors or those with chronic health conditions if you have symptoms or are sick. If you have chronic health conditions, avoid all necessary social gatherings, especially in our public parks. We do understand that the weather is warm, but social distancing is a must at this time. Pay attention for alerts from your local officials. For live assistance for medical information regarding COVID-19, please call 211 or 1-800-222-1222. Be safe. Thank you.
Hi, and welcome back. We have Frank McGehee and Candice Davenport with us, and we've been discussing the health crisis, the coronavirus crisis, and some of the things that we are or should be doing. So we ended the first segment of the show talking about masks and the need for masks, and Frank was mentioning that it's important to have them with you and to wear them as much as possible, especially when there's no social distancing, and that can happen. So, it's more than just the grocery store. Candice, I wanted to ask you, what are some of the things that people can do to help? People, I'm sure there's people who want to volunteer, want to do different things. What are some of the options that they may have?
Right. So I know that people have been helping out, and you can join on various Facebook websites to look at making face masks for community members and healthcare responders. There's also the COVID-19 New Jersey information portal. And I know that website's going to come up later on in the resources, but there's actually a help section where you can volunteer to deliver food to people or other things to be able to do around the state, which is super helpful. You can also volunteer and sign up for the Essex County Medical Reserve Corps. We're looking for those who have clinical or non-clinical experience to help us out during a public health emergency like this one. So should we ever be able to ramp up a vaccine clinic like we do for flu every year, we could sure use some help there. If people would like to help and donate blood. So while we're in this pandemic, we also have a huge public health emergency of a blood shortage for those who need it in the hospitals. So if people would like to donate, they can go to American Red Cross or Vitalint or other websites to look at how they can donate blood. We're actually having a blood drive here in Maplewood this Wednesday, and all of the appointments are full. So thank you to all those people. If those who have recovered from coronavirus would like to donate their plasma, it's called convalescent plasma or recovering plasma. If they would like to donate those, they can also contact the American Red Cross or those other blood services and see if they're running those tests. What the plasma can do is help us to identify antibodies and help us to create a vaccine. So that's super helpful as well.
Are there any, almost everybody is probably going to want to help, but are there people who maybe shouldn't? I mean, and for giving blood, are there any restrictions on age and that kind of thing?
No restriction on age. They just ask you that if you are sick, please do not come. If you think you've been in contact with someone who's sick, please don't come. If you go to their website, they give you further restrictions of who should be coming to these public events. But they're more specific on the website. But they actually have alleviated a lot of their restrictions from the past because they are in desperate need for blood.
And what about if you volunteer, say, to deliver food or that kind of thing? Are there people who maybe shouldn't, or what precautions should you take if you are accepted, are able to volunteer, and you want to volunteer?
Right. So the organizations who are organizing these food deliveries have their guidelines and precautions. So they would walk you through those. They're also listed on their websites. If they identify you as someone that they could use in that area to deliver food, they will provide you with the precautions. Namely, leave the food at the front, potentially call up the person and tell them that the food is there. Stay 6 feet away from anyone, wear gloves, wear a mask on delivery.
Okay, one last question for you, Candice, and you can chime in on anything we're talking about. I had some questions I wanted to ask Mayor McGehee, but what symptoms should we be concerned about? I guess I found that a little bit confusing myself. What are the, everybody gets a sniffle now and then, but what should you be really concerned about?
Right. So with coronavirus coming at the same time when we were coming off of flu and then going into seasonal allergy season, it can be confusing. But one of the three major symptoms that we're looking for is a fever, shortness of breath, and coughing. But not all coronavirus cases have presented with all three of those. Sometimes you have those, and sometimes you might not have them at all. Other symptoms that we're noticing are a headache, a really bad headache, chills with a fever, loss of taste and smell or loss of appetite, body aches, extreme fatigue, diarrhea, nausea, vomiting, sore throat, and runny nose. Those can be found along with the cough, fever, and shortness of breath, but those are the three major ones, and those other symptoms are also identifiable for coronavirus.
Okay. Now I'd like to just ask Mayor McGehee, what are some of the actions that Maplewood has been taking to, in this particular time frame? Are we coordinating anything with any of our surrounding communities, or, as Candice mentioned, some of the food deliveries and stuff? Do we have anything like that going on?
Yeah, Larry, no, thanks a lot. There's an assortment of things that we're doing currently to combat the virus. From a community perspective, we really have great volunteers and great community leaders that have really stepped up. For example, the parenting group with Karen Willman, she set up a food bank program where we've been able to provide food to deserving families. Over 170 families received 4 weeks of food, and we're preparing for the next row. Actually, we did the next one of 5 to 8 weeks. So we provided food for deserving families, hundreds of families in our community. Chris Dixon of the Rim Party Parent has been part of that. Kate Cahill with the organization Meeting Essential Needs with Dignity at Our Lady of Sorrows has been part of that as well. Jay Gizzo, who is a teacher in our school district, has started a phenomenal program of building masks and safeguards for first responders and for hospital technicians and workers in our community. And between his leadership, we've had thousands and thousands actually created with a 3D printer. I know my wife and myself have done about 50 ourselves, and we dropped some off at Candice's home the other day for the blood drive. But it's there's people stepping up. And then from a municipality perspective, we've been very thoughtful about how we manage the day-to-day operations of our government. And first, I'd like to touch on our first responders, which is our police, our fire, our public works, and of course our health division. When our police officers are going out there, they have gloves, they have masks when needed. They're thoughtful in terms of any type of interaction with the public. Our fire, who are all EMTs or EMS trained, take very deep caution when they're about to go and enter a particular household or step to a situation where there could be COVID-19. So they'll come in Tyvek suits and fully geared up and approach a situation very carefully. And then once they do that run or that call, if you will, and if they have to transport to a local hospital, they come back and go through a detox program, if you will, including a deep cleaning of the apparatus to make sure that it's safe for the next run. And I can't say enough about our firefighters who've been going on so many runs in the last couple of weeks to a month, related to COVID-19. And, it's taxing. It really is. But they've just been, their morale's been amazing, and we really appreciate that. And then also, for our public works department, sometimes the unsung heroes, they're out there doing the day-to-day activities to keep our town running. And, we've had some bad storms in the last couple of weeks, and they're out there removing tree branches and keeping our gutters clean and making sure that, that things that we take for granted, are being addressed. And I really can't say enough about, the Department of Public Works and their team there. And all in all, government is essential. And so, our finance team is still, looking at cash flows and balancing our budget and paying our, our expenses. Our recreation department is thinking thoughtfully about where to taper down programs, what programs work and don't work. We have a significant program with SOMAtv Towns, led by Kathy Rowe, which is kind of indirectly dotted lines to our rec community affairs department, and they're doing a great job with providing for our seniors in the community, in terms of making sure they have rides if they want to go to the grocery store or any other goods and services that they need. There's just so many things happening at the municipal level. We have tons of conversations, both online and on the phone and on a daily basis, just about everything that you can imagine. And it's not just at our level too. I mean, I talk with mayors across Essex County, Mayor of Milburn, the Mayor of South Orange, of course, Mayor Voss in Irvington, just making sure that we're, collaborating thoughtfully. And then on top of that, there's a couple calls a week. We have a mayor's call with the other 21 mayors in Essex County. We're all on that call with our county executive, Joe DeCinzo, and with Phil Elijah and the sheriff and many other key members of the Essex County team to make sure that we all have the right information disseminated properly. If there's a need for masks or PPE or any type of other needs, we can discuss that collectively. And there's a course documentation that's sent out twice a day, pretty robust with case information, test areas, a whole gamut of information that I read through and sometimes I disseminate out to the public in my daily press release, or we leverage it internally as a municipality and leverage it in the better good of the community. So there's a lot going on, in terms of coordinating and also aligning with not just internally as a municipality, but also just, with our community and the great work that they're doing on behalf of Maplewood.
Well, thank you for that. You mentioned about all the coordination and so forth with the different towns and the time you have with the community, with the county executive and so forth. What about the school district? Will that reopen on the basis of a county decision, a state decision? I mean, I'm sure a lot of people are wondering when kids will go back to school. Do you know, what can you tell us about that, Frank?
That's a great question. I will say, in the beginning of March through end of March, myself and Dr. Taylor were talking on a daily basis, obviously, with there being such a direct correlation between what the school district does and our township. What I can tell you right now is that what Dr. Taylor's provided in terms of the digital schooling and education is in place and will be in place for some time. The school district is being very thoughtful about the phased approach they're taking. And before any decisions are made, we have a conversation with myself, Dr. Taylor, and key stakeholders about what this means for our community, because in Maplewood we have so many families that are in our school district, and if they're not able to go to school, that impacts childcare and other operations. Some of our families have the ability to work from home because of their occupations, and some of our families don't. And so there's that balance there under we make a decision how that impacts our households, and also that factor into the food insecurity we've already discussed. And then equally importantly, to a certain extent, is the technology. Not everyone in Maplewood has a computer at home or a laptop or even Wi-Fi. I think the CHIEF program has done a phenomenal job. They had allocated at least $10,000 to the school district to purchase more Chromebooks and some Wi-Fi hotspots to try to meet that gap that we have for those who don't have that technology, so that we have a level field for all of our students so they can learn equally. But to answer your question right now, the school district hasn't communicated at this point regarding when that finite date will be. Trust me when I say a lot of people are wanting to hear that finite date. And that's a deeper conversation because, in the last week now, we at the township have started to create a strategy about, what does it look like when we roll back to the new normal? Because I don't think we're ever going to have the same normal we had before we called the state of emergency on March 12th. That was when we made the declaration. That was at 11 p.m. on March 12th, which was only 36 days ago. Lots happened, but we're getting there in that regard.
No, and we're getting to the end. We're just about out of time. So real quickly, if we only have about 10 seconds left, is there, if we go to the township website, is there a list of stores and things that might be open or not? Do you know? We have
a link on our website that talks about our SIDs, our special improvement districts, and there you'll have a list of all of our small businesses that are open with their hours of operations. But if you go to the Springfield Avenue Partnership website, their COVID page on there, and then Maplewood Village Alliance and their COVID-19 page there, you'll have information about every restaurant that's open, the hours of operation, pickup, delivery, anything you'd like to know.
Okay. Frank, thank you. And Candice, thank you. I guess we're going to have
Thank you, Candice.
Good luck, and thanks for all the support and leadership you guys are providing. Take care.